I'm a member of the Appalachian Mountain Club, so I would go hiking a lot, and I was having trouble hiking. My foot, I'd be in too much foot pain. And we would go on 7 to 10 mile hikes, and you don't want to be that far out and not be able to walk back.
And how long have the bunions been bothering you?
For about 15 years.
So why did you wait 15 years to come see the doctor?
I just kept putting it off. I've been to other doctors where they've given me the orthotics, but I can't put the orthotics in every shoe. So I've just been suffering with the pain, especially at night. Like the sheets over my foot, kind of, even that touching my foot hurts. So I'm tired of the pain now.
The bunion is the problem, but the cause is the abnormal mechanics. So something is wrong or off in the foot. So Lucia is a little flat-footed, so when she stands, the arch collapses. So that's called flat-footedness or pronation. And pronation is contributing to her bunion, which actually causes deformity here, and the first metatarsal, which is the bone right here, goes out or bows out, causing the other toe to go in because the ligaments and tendons are still attached here, causing this toe to push in, pushing against the second toe.
Since I waited so long to have surgery or to talk to a doctor about surgery, the second toe has now turned into a hammer toe. So there's a lot of pain with that toe, and there's a lot of pain like underneath the foot. So it needs to be fixed.
Commonly, when you have a severe bunion deformity, you can have something called a hammer toe contracture, which is contracture of the toe, bending at this joint because the toe has to get out of the way for the bunion.
I've heard a lot about PA foot and ankle, and I wanted to talk to Dr. Teichman. So when I met him, I felt very comfortable, and if I was going to have surgery, which I am, I would choose Dr. Teichman. The reason for the delay in the surgery is that I would have the surgery and there would be no improvement from the pain that I have.
And what has the doctor told you?
That I should be very happy after the surgery. Can you explain what you're going to do there? Are you going to put something
That's
to...
fair. So what we do is we make an incision from about here to about here. Okay, and once we make that incision, we go ahead and we break the bone. We call that a surgical fracture after shaving this bump down. That allows us to realign the toe. And once we realign the toe, we shift the toe back over and we stabilize the break with 1 or 2 screws. And that allows us the toe to look like this after surgery. We went and shaved this area down right here. So we made a V cut from here to about here. And that allowed me to swing the bone over. And also we shaved this bone down here. We shaved that bone off. That spur. So we can, if we go back to the post-operative view, the toe's realigned and now the spur is gone as well. So a nice outcome. So we're putting another protective sterile dressing on the foot because her sutures are still in, which will come out at the next post-operative visit.
Leave the crutches alone.
A friend of mine got engaged, so the fiance wanted a flash mob. So we all got together and we did a flash mob. So a lot of circles, not really dancing, but stepping back and forth and spinning around. So.
And that was how many days after the surgery?
I think it was 2 weeks.
How's the pain?
What pain? No pain.
No pain at all?
Nope.
So we're 2 weeks out We're going to keep you in the boot for another 1 to 2 weeks, a total of 3 to 4 weeks.
Okay.
And then we're going to go ahead and start you walking in a shoe at about that time.
Okay.
So stay in the boot, and when I see you back, you will bring a sneaker with you.
Oh,
Start walking in a sneaker.
Okay.
Okay, and we'll keep you in that sneaker for about another 3 to 4 weeks.
So Lucia, how would you rate your experience so far?
It's been fabulous. Like no pain. There's no scar, which is amazing. I am in zero pain. Before I had the bunion gave me pain, and I also had a spur. So I think with both those things gone, I am in zero pain right now. So it's wonderful. I shouldn't have waited 15 years to have my surgery. So yeah, I'm very happy. Today is April 28th. My surgery was on March 18th. Where the bunion surgery was, there's no pain at all. I have a little bit of tenderness, but
Oh, looks
no pain.
great.
It looks fabulous.
Does it feel good?
It feels great.
And your scar is awesome. Looks beautiful.
Good work.
Cool.
So what am I supposed to do differently in a shoe?
Nothing. Walk.
I can walk like miles?
Well, what are we, 18? We're about 6 weeks out, right? Yeah, you should be able to walk miles.
Wow.
Start gradual, but get back up to it.
Okay.
Yeah. Your x-rays look phenomenal. So did before. See the bump there? And then the after. You see it says moist lined up nice, toes nice and straight. So, looks really good.
So I can hop, skip, and jump out of here? There we go. Let's see if I can do this. It's perfect. It feels great.
What's the first thing you're going to do now that you have 2 feet that work?
I'm going to dance. I would love to get back into hiking. I got my hiking shoes on right now, so
Right.
I'm going to go. And it's such a beautiful day today. Maybe today. Like we said, there's going to be no scar. I'm like a scar freak. I don't like scars. So there's not going to be anything showing there. It's really great. It looks great. I feel great. Now I need to go to work after I hike. So feel good.